I would see about 8 hours of video, 9 hours of video on 1.5x or 1.8x speed. And then later part of the day, I would go for QBanks. I would solve QBanks. And when I get tired of QBanks, I would go for custom modules. So that's how I used to prepare. Paper was so in sync with Marrow QBanks. I found every question similar to the QBank. I found mostly 10 to 12 questions that was new to me. All questions were similar to me from the QBanks.
Hello students, very good evening to all of you. This is Dr. Malcolm, Faculty of Dermatology at Marrow. It is my esteemed privilege to welcome Dr. Ameena, who has done exceedingly well in the recently concluded FMGE exam and scored 236, which is an excellent score in the exam. So heartiest congratulations, Dr. Ameena.
Thank you, sir. Thank you very much. Thank you for having me.
Yeah, same here. And Dr. Ameena, what was your primary source of preparation?
Sir, I used Marrow for my
Which
preparation.
Plan were you subscribed to?
I am subscribed to Plan C.
Plan C, okay. And out of the Plan C, which was the video plan, which were the videos that you watched and which sort of you liked in terms of remembering and which has helped you a lot?
So videos I watched was main videos for subjects like obs-gynae, orthopedics, forensic medicine, radiology, and some videos from surgery also. And I used to handpick videos in the topics which I feel I was deficient in knowledge. So I used to watch videos like that.
Okay. Any faculty that you remember from the videos which whose videos when you watch probably like apart from exam would really like sort of make you fall in love with the subject, or some subject which you were not so interested in, like made you interested in and sort of then turned your weaknesses into strengths rather, out of the videos that you have watched from Marrow?
Sir Abbas Ali sir's video on orthopedics.
Okay.
I was not inclined to orthopedics as a subject, but he made me fall in love in orthopedic. He teaches so well in such a good accent. I really liked the subject, teaching from him. And also Sakshi ma'am's OBG. She made conceptualized every topic in such a way. I fell in love in OBG also. And she made the subject so easy to learn.
Okay, and have you been following Abbas sir on his YouTube channel as well?
Yes, I'm following him everywhere. Telegram,
Okay,
YouTube, Instagram, whatever.
Yeah, he's a great motivation to all of us as well.
Yes,
and what about surgery? Like, have you watched videos from surgery as well, biochemistry?
Yes, sir. I watched videos from surgery of Rohan Khandelwal sirs in some topics. And for biochemistry, Rebecca ma'am's video have helped me immensely. I'm really weak in I thought I was weak in biochemistry, and she made it really easy for me to solve biochemistry questions.
Okay. And usually in your schedule of study, how many hours of video would you watch in a particular day, like on a given day?
In starting point of my preparation, I was only watching videos, like 3 to 4 videos in a day, 4 to 5 hours of video. I couldn't sit more, but in to the end of the preparation days, I would see about 8 hours of video, 9 hours of video on 1.5x or 1.8x speed. And then later part of the day, I would go for QBanks. I would solve QBanks. And when I get tired of QBanks, I would go for custom modules. So that's how I used to prepare.
Okay. Since you mentioned you were solving question bank as well, so would you do the question banks which were related to the videos, or it was like you were doing two separate subjects different from the videos and unrelated Q banks, or did you sync it together?
No, sir. What I would do that the topic which I read from notes, I do QBank of that topic on the same day. And I would do QBanks also from the topic which I have read the previous day.
Okay.
That was my pattern.
So both of them were syncing together, and the extra points from QBank, like would you bookmark them, or
yes,
would you write it into your notes, or how would you build onto your extra points?
Yes. The QBanks have their amazing explanation to them. Though I was I would read all the explanation. I would write every point from that explanation. If it is missing in my notes, I would rewrite it. I would upgrade my notes in that regard. I would highlight it if it repeats. So uh, it went like that.
Okay. And apart from the regular videos, there are also additional features in Marrow. Like we have the MCQ discussion videos, then there are revision videos. So, and there are also image-based videos. So, any of these resources which were useful or you happen to use them during a preparation?
Yes, sir. I watched image-based videos in last month of my preparation, and also I saw revision videos for a couple of subjects, not all. Couple of
Okay.
subjects, like short subjects, I used to do revision videos.
Okay. And in the exam, like how did you feel was the level of difficulty of the exam which you wrote just now?
Sir, difficulty according to me was easy to moderate type. I would say part two was easy for me, but part one was about easy to moderate difficulty for me.
Okay, the difficulty was more of like because the questions were long stem kinds, or you usually have a difficulty when it's a one-liner question which has more of memory-oriented points which are involved. What is more difficult for you generally to get right a question in the exam?
So difficult for me is conceptual, the long questions in
Okay,
which I have to uh, keep my memory in a gear, that I have to recall it. Okay, what was it? And in one-liners, what I did was I made a many silly mistakes. It was, I
okay,
think, due to some recall bias or something. But yeah, silly mistake got me in many questions.
okay. Few silly errors here and there. Okay, fine, fine, fine. And what about how would you approach notes? Like you would write your own notes, or like you rely on ready-made notes? What would you do about notes? You would write them yourself?
Yes, sir. I wrote my own notes. I used to read textbooks during my prof years, so that helped me write my notes. And then I upgraded my notes from Marrow itself, and then
Okay.
QBanks, and my notes got upgraded that way,
Okay.
time by time.
Okay. And when you were doing question banks, generally, well, how many MCQs would you solve in a particular day? Like roughly around like how or how much time you would devote in terms of questions or in terms of time?
Sir, in starting point, I was not able to do many questions. Hardly 100 question was a lot for me. But in the
Okay.
later part of my preparation, I would go about 200 to 250 question in a day easily.
Okay. So you could go up to 200 to 250 questions in a day. Okay. Fine. And what are the good features of QBank that you like? Because you've used it extensively. So any particular feature that you like, or you want to tell your juniors, like this is the way to read QBank. So one point which you've already told us is like you are syncing the videos, whatever theory you are reading, you are reading the questions which are related. So that becomes like a double revision, isn't it? You've already read once
Yes,
and you revise through QBank again. Because QBank
yes,
is
sir.
more of a learning tool also, more than an assessment
Learning
tool as well.
and testing too.
Yeah,
Yes, sir.
like how Abbas used to always say. So apart from that, anything else like which QBank that you liked?
So QBank have that review feature. We can hide the answer and review it. That helped me a lot in recalling, for active recall, for passive recall. Then, sir, in QBank, the explanation part that helped me massively, I must say. Also, bookmark. I used to bookmark the question which I have never saw, which were new to me, and then I would go back and revise it. Though I bookmarked many questions, but I wasn't able to revise all of them. So, yeah, I used it that way.
Okay. And have you used this Pearl feature of Marrow? Was it useful or have you used it extensively?
Yes, sir. Very extensively. I revised very much from the pearls. At the end of the day, when I'm very tired, I'm about to sleep. I used to open pearls and revise from pearls. I used to do recall, like hiding the answers and then recalls from pearls. So I have used pearls of almost many subjects, not all subjects, but many subjects.
Okay. Do you generally prefer studying alone or you would do group study? Like what works better for you, like in terms of studies? Like do you have a study partner like that or you would study on your own?
Sir, during my prof years, I have a study partner. She is my roommate. We used to
Okay.
study together. But during this COVID era, when we were away, I uh, grow. I grew into studying alone. So now I enjoy studying alone also.
Okay. And have you given the mock tests of Marrow, which were FMG oriented exams? So, if so, like how were you doing in those? Like, how many tests have you given?
Not much, sir. I say 5 to 6 or 7.
5 to 6.
I
And
used
how
to
would you
solve
do in
past
it?
year. Uh, like in first or second mock test, I got only 151, 153 like that, and
Okay.
then it progressively increased to 170, 190. That's what I remember.
Okay.
Uh,
And finally, when you saw the exam paper, and when you compare to the Marrow mock test, what is your observation like? The Marrow exam is more difficult, or is it in sync, or what was your observation like? Did you feel the paper which came in the final exam was completely new types, or you feel like you were equipped enough to at least it challenged you enough so that you could think in the exam on your own?
no, paper was so in sync with Marrow QBanks. I found every question similar to the QBank. I
Okay.
found mostly 10 to 12 questions that was new to me.
Okay.
Other all questions were similar to me from the QBanks.
Okay. All
So
you
I
have to
didn't
do is
find
try to
it.
recollect from which part is asked and
Yes,
those kind of things, except for 10 to 12
yes,
questions.
yes, sir.
Fine. And any particular thing that you did for previous year's questions, would you do them as well?
Yes, I extensively did previous year questions. I solved all the questions, and I actually solved them multiple times. And I used to write all the questions which I got wrong from the previous year question and revise those also. I,
Okay. So when did you exactly start revising? Like
mm, so I must say in month of September,
the month of September. Okay.
Mid September to October, I was in revising mode.
Okay. So how many revisions you could give before the final exam?
Two, 2.5. I
Two
couldn't
to two and a
finish
half
the last
revisions.
revision.
Okay. So that means before September you stopped watching videos, or still you were doing here and there some videos?
Yeah, I still were doing year and year videos because I was not confident enough. I thought something is, I'm leaving behind something, something would
Fear
come
of
up, and
missing it.
what if I have not watched it? So,
Correct. And what did you do in the last 7 days? Like last 1 week, what exactly did you do the difficult subjects, or did you try to brush through the entire notes once? Like what did you do exactly?
yeah, what I did was from 1st of December to 12th of December, I made a timetable in which
Okay.
I kept difficult subjects on the top. In the initial days, I would do difficult subject. Oh, what I would do was see notes from first page to last page, the highlighted points. I would make a different type of highlighting in my notes, which I have to read. So that way it
So there was
went
a color
from.
coded system there. Okay, nice.
Yes, yes. So difficult subjects was to first, then orderly it went. And in last 2 days, I saw all the books. And I read all the notes from first to end of all the subjects. I couldn't get enough of it. I was not even confident enough. I thought something is leaving behind, and what if questions
Correct.
come from them? I
So
was
finally, in the
anxious
month
that
of
way.
December before the exam, you could flip through all the pages once, isn't it?
Yes, yes,
Yeah, that's a very important thing for all the students who are preparing, because it's very important that you see through the topics once. So that also gives you a feel that you're likely to remember it in the exam as well. Okay, so that your confidence
yes,
is
yes.
also very high because of that. Okay. And one more thing which I wanted to ask you is any particular mistake which you feel that you committed, which you tell your juniors you shouldn't do. Hindsight, when you think about this journey.
I made many silly mistakes. I must say, many silly mistake is many easy question, and I felt that it was deficient in my revisions. So I would suggest that to avoid the silly mistakes, revise as much as you can from your own notes, if preferable own notes.
Okay. Just about the silly mistake, is it like you would make silly mistakes in the previous mock tests as well, or you made some new mistakes like which was only on the exam day? Because usually one mistake which a lot of students do is they take the practice test a little easy. So what happens is they do it when they're very comfortable. So there's no stress. And on the exam day, because you have this pressure of getting the questions right, so in that situation, the silly questions go wrong actually. So what do you feel like? What is your take on it?
Yes, sir. During mocks, I used to get silly mistake of same kind, which I made in during my final exam. Like I made the same mistakes which I used to make in mocks. So it was kind of I
What
didn't
if you could
feel
just
good
list
about
out
it.
so that even students will know, like, what kind of a mistake? Is it a numerical value kind of a thing, or is it like community medicine, some program, or is it a named sign? Like, what exactly you usually used to get it wrong, which some of them you couldn't correct it till the end.
Sir, it's like I get used. I got confused between two options. That was a questions of anencephaly, and the options were it was a failure of closure of anterior neuropon and
Okay.
a non-fusion of cranial bones. So I knew the answer was a failure of closure of anterior neuropon, but still I marked the other option. So that's the kind of mistake I do.
Okay, fine. It's nice that you've shared this because what happens with confusion is unique to a particular person. Somebody else may think, how can a person get confused? But there will be something which I get confused, which will be silly for you, isn't it? So
Yes,
it's
yes,
nice that you brought out this example so that everybody knows. Like a lot of teachers have mentioned to keep the separate book called the 20th book, wherein they can write all these confusing things. Okay. One thing which you have done very nicely in your preparation is color coded your notes so that you know which is like
yes, sir.
must read or probably which you know types. Because another mistake what students do is they keep reading what they know again and again, and all the difficult topics are left till the end actually. And just 1 or 2 weeks before
Yes,
the exam, you don't feel like seeing it because you're already worried. So this is probably another solution for this problem that you faced is probably, since you're most likely to be preparing for the NEET exam, is to maintain the 20th book wherein you
yes,
write
sir.
these tough topics and exclusively revise it so that you don't get them wrong. So that can be one solution looking ahead.
Yes, sir.
And what about image-based questions? Were they your strength or weakness?
Strength, sir. I am very good at image based.
Okay, any particular subject or in general? Like, is
In
it your
general.
strength? In general, because what I've
In
seen from
general.
dermatologist's point of view is many times students memorize images. Only if the same image comes, they get it right because they don't look at the morphology, configuration. Once you memorize the image, what happens? Little bit there is it's little twisted here and there. Then if some other patient is shown, then it is difficult for them because that
Yes.
picture is what they have memorized. So in dermatology, we always say that try to remember the morphology, the configuration, and how it
Yes,
is
sir.
arranged, because for a dermatology picture you definitely need these. Probably some program pictures are there, some instrument is there, it's okay. Like at the
Mm-hmm.
most it will be placed in a different direction, the instrument will remain the same. So this is something which I want the students to remember. Like in a subject like dermatology, you always try to look at morphology, configuration, and distribution, because nowadays you don't get
Yes, sir.
Google images. Many times the examiners
Uh,
give their own images, so you get these right. So that will be a good point for students who are preparing ahead, especially in terms of image-based discussion. Okay. And
right, sir.
what is the role of integration? Did you find a lot of integration in the questions which were asked in the exam?
Yes, yes. Many questions were integrated in such a way that I couldn't even make that question was from which subject,
Which subject?
like
Okay. Okay.
pathology,
Yeah,
medicine,
they'll give
and
you a clinical
everything was
scenario.
integrated.
The peripheral smear finding will be there, or probably a microbiology,
Yes, sir.
infectious disease question, and the answer is
Yes,
in
sir.
microbiology, isn't it? So
Right,
finally,
right.
the second year subjects, that is pharmac, micro, and patho, seem
Pharma.
very, very important to get even the final year questions correct, isn't it?
Yes, sir.
So like that. And Dr. Amina, right now, what are you doing? Like, are you studying? What are you exactly pursuing?
Yes, sir. I've started studying for MRCP. I'm uh, planning to give MRCP Part 1 in coming months. And
Okay,
also,
nice.
I started studying for NEET PG, whichever suits me well or comes first, like that.
Okay, I think with the type of preparation that you have done and the kind of score that you have got, you are definitely in sync with whatever is happening. And since personally, I've been teaching the foreign medical graduates since 4 5 years, and all that we are seeing is that the foreign medical graduate exam, the INICT exam, and the NEET is all going towards the same thing, and finally it will merge and
Uh-huh.
become the next. So definitely, because
Yes,
the
sir.
previous time also there was a question on segmental vitiligo, which was asked in FMG, and that question came in INICT exam. So definitely we are heading towards a merger where the FMG exam has become so close, and finally it's going to merge as next, so that everybody needs to be preparing the same way. And the way that you have prepared using notes and all the videos and the question banks and the pearls, I think I would request you to continue with your preparation, not let your guard down,
Yes, sir.
so that it translates into better results, and it even gives you excellent and better results in the NEET PG as well as the MRCP exams which you're planning to write.
Yes, sir. Thank you very much, sir. I'm really hopeful, and I'm planning to continue on Marrow itself. I'm planning to complete all the videos and keep upgrading my notes, whichever is left.
Yes, because Marrow always tries to set it a little on a higher side so that you'll be able
Yes,
to
sir.
crack those difficult questions as well, right? Because now, when you
Yes,
were
yes,
preparing for this exam, it was more of just crossing the 50% barrier. Later on, now you'll
yes, sir.
be aiming for something different where you've already started the preparation. And the same thing, if you continue, like you mentioned your notes so well, all the addition which is required will definitely push you at a higher level. And I wish you all
Yes,
the
sir.
best that you'll be able to achieve this.
Thank you very much, sir.
Any particular advice you want to give your juniors, like who are preparing for the foreign medical graduate? They may be in third year or fourth year. They would have started with Marrow. Like, how is the best way to use Marrow in terms of their knowledge as well as for off exam as well as for exam preparation?
Uh, sure, sir. I would firstly like to say, if you are in first or second year of your study, then start using textbooks, read textbooks for concept, and surplus it with Marrow videos. The faculty videos will help you in making a concept to the point. You'll remember it forever, and then then jump up to QBanks and do as many QBanks as you can, and it will help you immensely. I must say, Marrow QBanks is so vast and so rich in knowledge. It would definitely help you in enhancing your knowledge, and FMG will be shortly cleared
Sure.
by that.
Okay. So thank you, Dr. Ameena. It was great talking to you, and thank you for giving a good message to all your juniors who will be writing the same exam in the upcoming session. And wishing you all the very best in your future endeavors.
Thank you very much. Thank you very
Thank you.
much, sir. Pleasure is all mine. Thank you very
Yeah,
much.
same here. Thank you.